It's a real pleasure to be here with you. The last time that I was here to hear Speaker Minnis lay out some of her thoughts. And I thought, boy, I'd really like to have a chance to share some of mine. And so I appreciate so much the invitation from all of you to come today to talk a little bit about the legislature. And I appreciate Senator Courtney for giving me a little free psychoanalysis and therapy. I may be returning to you on during the session as things get tough. You've heard from President Courtney about some of the significant issues the legislature is tackling, and I'm going to add to that list, starting by taking you back to the first day of the session. On day one, the House changed the House procedures to emphasize problem solving over partisanship. For 2 decades, state chambers across the country have been increasingly polarized, following the advice of strategists like Grover Norquist, who said that my goal is to turn every state into a bitter partisan battlefield. And that strategy has damaged our nation, it's damaged our legislature in Washington, D.C., and it's damaged our state. And it's time that we move in a different direction. So on the first day of the session, the House restored the independence of the House parliamentarian. We ended committee stacking, which the Senate had done 2 years earlier, that is, ended it, whereby the majority party has disproportionate representation on committees. And we reestablished the Rule of 31. Now, this Rule of 31 needs a little explaining. There are 60 members. The Rule of 31 means a majority. And that a majority of House members can at any point bypass the Speaker and bypass the committee chair to put an issue on the floor of the House for debate and for a vote. Or put differently, this rule ensures that bipartisan collaboration can trump partisan control. The Oregon House, as far as we've been able to determine, had a Rule of 31 for 146 years, our entire history as a state, until 2005, when it was extinguished. And it was a pleasure to lead the House in restoring this protection for bipartisan power on day one of the legislature. So it's my hope that these changes, working together, bring legislators together. And it'd be wonderful in June if we're able to characterize this session as having replaced bitter warfare with better bipartisan problem solving. Also on opening day, the Oregon House, we radically altered the culture of gift giving, symbolized most flamboyantly by gifts of trips to Maui and $200 dinners. You may have heard something about that. Gifts of significant value really serve no legitimate purpose in the legislative process. We do not allow gifts to voters who judge the candidates. We do not allow gifts to judges who weigh the prosecutors and defendants' claims. So why do we allow gifts to legislators who must choose the wisest course among policy options? So on day one, we ended the gift culture in the Oregon House. From people with an interest before the legislature, no gifts of entertainment, no gifts of fancy private restaurant meals, no gifts of travel and lodging outside the state, and no gifts of items of more than de minimis value. This allows people to bring the mug or the T-shirt representing their club and ask their legislator to display it or use it to publicize them, and that is the appropriate de minimis level. And if you'd been in the Capitol in the first week, you would have seen something very different. You would have seen these yellow signs go up in the inboxes that say, "We are not taking gifts, thank you very much." And you would also have seen staff members running down the aisles to try to catch someone who had left something at their office to ask them, "Who are you and why did you leave it and what is it and what did it cost?" And it really is a symbol that we are there to increase the professional nature of weighing good policy. And there's more going on in the ethics area than just the gifts. House Rules, led by Speaker Pro Tem Rosenbaum, just passed out a revolving door bill, and it creates a 2-year break between serving as a legislator and a lobbyist. And the Oregon Senate is hard at work. President Pro Tem, Majority Leader of the Senate, Kate Brown, leading her committee, has Senate Bill 10, which is tackling multiple issues such as gift giving, reporting transparency, independent improved funding for the Ethics Commission, as well as Senate version of revolving door. So a lot of work is going on, and this work is all about restoring the social contract with the Oregon citizen, that we are in Salem to serve the citizens and not to be distracted or influenced by gifts and trips and meals. Well, that was day one. So now let's turn to health care, more specifically health care for children. There are 117,000 uninsured children in Oregon. And if you line up these children, one behind the other, they would form a line over 40 miles long. So you can kind of imagine a line looping around downtown core Portland more than 10 times. Or you can envision a line of children stretching from this building, if you spread them out just a little bit, from here to the Capitol. It is unacceptable that we as adults have not provided accessible, affordable health care to all the children of our state. So the Healthy Kids Plan would do exactly that, strengthening clinics and putting insurance within the reach of all Oregon families. And to pay for this coverage, we are putting forward an 84-cent increase in the tax per pack of cigarettes. Studies estimate that the health care costs, the health care costs borne by the public equal as much as $11 per pack. So it seems like a pretty square, fair deal to ask for 84 cents to help improve Oregon's health care. Moreover, a significant share of the new revenue will go to tobacco use reduction programs. It will enhance the quality of life for thousands of our children who don't take up smoking. And it is much less expensive to provide tobacco education on the front end than to cut out a lung or a diseased artery 20 or 30 years from now. And let me tell you why this funding mechanism is so important. It makes no sense to establish a new program with revenues from a temporary upswing in the economy. When you do that, what you build today, you dismantle tomorrow when the economy turns down. And we learned that during the Oregon Health Plan expansion in the 1990s and the recession in 2001. So we need to establish a program for our children that is not precariously perched on a robust economy, but will survive the ups and downs that we all would expect in the years ahead. So that bill will be going to the floor in early March. It will not go to the floor to score political points, as suggested by a column in today's Oregonian. It will go to the floor because the only way you can debate a bill is to put it on the floor, and the only way you can pass a bill is to put it on the floor. And toward this goal, I spent 10 hours 2 weeks ago with Democratic and Republican leaders locked in my office working to improve this plan. And out of those conversations came half a dozen changes, improving the bill that have now all been adopted in the House Revenue Committee, and the bill has been sent on. In fact, just a week ago, those changes resulted in a bipartisan majority passing the bill out of Revenue and sending it to Ways and Means with a do-pass recommendation. And just 2 days ago, U.S. Senator Gordon Smith and Governor Kulongoski stood side by side in Salem advocating for this bill. Senator Smith said that we need this health coverage for our children. And he said the tobacco tax is the right mechanism to pay for it. And you know what? He's right. He is right. And so what we're about is doing good policy in a bipartisan fashion, and when we get there, I will be the first and the loudest in giving bipartisan credit for the success.